Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Tenecteplase for ischemic stroke at 4.5 to 24 hours without thrombectomy. Background. Tenecteplase is an effective thrombolytic agent for eligible patients with stroke, who are treated within 4.5 hours after the onset of stroke. However, data regarding the effectiveness of tenecteplase beyond 4.5 hours are limited. Methods. In a trial conducted in China, we randomly assigned patients with large vessel occlusion of the middle cerebral artery, or internal carotid artery, who had salvageable brain tissue as identified on perfusion imaging, and who did not have access to endovascular thrombectomy, to receive tenecteplase at a dose of 0.25 mg per kilogram of body weight. Maximum dose, 25 mg, or standard medical treatment 4.5 to 24 hours after the time that the patient was last known to be well, including after stroke on awakening and unwitnessed stroke. The primary outcome was the absence of disability, which was defined as a score of 0 or 1 on the modified Rankin scale, range 0 to 6, with higher scores indicating greater disability at day 90. The key safety outcomes were symptomatic intracranial hemorrhage and death. Results. A total of 516 patients were enrolled, 264 were randomly assigned to receive tenecteplase, and 252 to receive standard medical treatment. Less than 2% of the patients, 4 in the tenecteplase group, and 5 in the standard treatment group, underwent rescue endovascular thrombectomy. Treatment with tenecteplase resulted in a higher percentage of patients with a modified Rankin scale score of 0 or 1 at 90 days than standard medical treatment, 33.0% versus 24.2%. Relative rate, 1.37. 95% confidence interval, 1.04 to 1.81. P equals 0.03. Mortality at 90 days was 13.3% with tenecteplase, and 13.1% with standard medical treatment, and the incidence of symptomatic intracranial hemorrhage within 36 hours after treatment was 3.0% and 0.8% respectively. Conclusions. In this trial involving Chinese patients with ischemic stroke due to large vessel occlusion, most of whom did not undergo endovascular thrombectomy, treatment with tenecteplase administered 4.5 to 24 hours after stroke onset resulted in less disability and similar survival as compared with standard medical treatment, and the incidence of symptomatic intracranial hemorrhage appeared to be higher. Risankizumab versus Ustekinumab for moderate to severe Crohn's disease. Background. The efficacy and safety of Risankizumab as compared with Ustekinumab in patients with Crohn's disease are unknown. Methods. In this Phase 3b, multicentre, open-label, randomized, controlled trial with blinded assessment of endpoints, patients with moderate to severe Crohn's disease who had had an inadequate response to anti-tumor necrosis factor, TNF, therapy, or unacceptable side effects with such therapy, were randomly assigned to receive Risankizumab or Ustekinumab at standard doses for 48 weeks. The two primary endpoints, which were tested sequentially, were clinical remission at week 24, defined as a Crohn's disease activity index score of less than 150, range 0 to 600, with higher scores indicating more severe disease activity, which was analyzed in the first 50% of patients to complete the week 24 visit, with a non-inferiority margin of 10 percentage points, and endoscopic remission at week 48, defined as a score of less than or equal to 4, a decrease of greater than or equal to 2 points from baseline, and no subscore greater than 1 in any individual variable on the simple endoscopic score for Crohn's disease. Range 0 to 56, with higher scores indicating more severe disease, which was analyzed for superiority in 100% of the patients. Safety was assessed in all patients who received at least one dose of Risankizumab or Ustekinumab. Results. In the full intention to treat population for the efficacy analysis, 230 of 255 patients, 90.2%, who received Risankizumab, and 193 of 265 patients, 72.8%, who received Ustekinumab, completed all the assigned treatments. Both primary endpoints were met. Risankizumab was non-inferior to Ustekinumab with respect to clinical remission at week 24, 58.6% versus 39.5%. Adjusted difference, 18.4 percentage points. 95% confidence interval, CI, 6.6 to 30.3, and superior to Ustekinumab with respect to endoscopic remission at week 48, 31.8% versus 16.2%. Adjusted difference, 15.6 percentage points. 95% CI, 8.4 to 22.9, p less than 0.001. The incidence of adverse events appeared to be similar in the two groups. Conclusions. In this head-to-head clinical trial of Risankizumab and Ustekinumab, involving patients with moderate to severe Crohn's disease who had had unacceptable side effects with anti-TNF therapy or an inadequate response to such therapy, Risankizumab was not inferior to Ustekinumab with respect to clinical remission at week 24 and superior with respect to endoscopic remission at week 48. Oral Nirmatrelvir, Ritonavir, as post-exposure prophylaxis for COVID-19. Background. Clinical trials of treatments for coronavirus disease, 2019, COVID-19, have not shown a significant benefit of post-exposure prophylaxis. Methods. We conducted a phase 2 to 3 double-blind trial to assess the efficacy and safety of Nirmatrelvir Ritonavir, asymptomatic, rapid antigen test negative adults who had been exposed to a household contact with COVID-19 within 96 hours before randomization. The participants were randomly assigned in a 1:1:1 ratio to receive Nirmatrelvir Ritonavir, 300 mg of Nirmatrelvir, and 100 mg of Ritonavir, every 12 hours for 5 days, or for 10 days, or matching placebo for 5 or 10 days. The primary endpoint was the development of symptomatic SARS-CoV-2, severe acute respiratory syndrome coronavirus 2, infection, confirmed on reverse transcriptase polymerase chain reaction, RT-PCR, or rapid antigen testing, through 14 days in participants who had a negative RT-PCR test at baseline. Results. A total of 2,736 participants were randomly assigned to a trial group, 921 to the 5-day Nirmatrelvir Ritonavir group, 917 to the 10-day Nirmatrelvir Ritonavir group, and 898 to the placebo group. Symptomatic, confirmed SARS-CoV-2 infection developed by day 14 in 2.6% of the participants in the 5-day Nirmatrelvir Ritonavir group, 2.4% of those in the 10-day Nirmatrelvir Ritonavir group, and 3.9% of those in the placebo group. In each Nirmatrelvir Ritonavir group, the percentage of participants in whom symptomatic confirmed SARS-CoV-2 infection developed did not differ significantly from that in the placebo group, with risk reductions relative to placebo of 29.8%, 95% confidence interval, CI, minus 16.7 to 57.8, p equals 0.17. In the 5-day Nirmatrelvir Ritonavir group, and 35.5%, 95% CI, minus 11.5 to 62.7, p equals 0.12, in the 10-day Nirmatrelvir Ritonavir group. The incidence of adverse events was similar across the trial groups, with dysgeusia being the most frequently reported adverse event, in 5.9% and 6.8% of the participants in the 5-day and 10-day Nirmatrelvir Ritonavir groups, respectively, and in 0.7% of those in the placebo group. Conclusions. In this placebo-controlled trial, post-exposure prophylaxis with Nirmatrelvir Ritonavir for 5 or 10 days did not significantly reduce the risk of symptomatic SARS-CoV-2 infection. Next, we will be discussing articles from Journal of American Medical Association. Electroencephalography-Guided Anesthesia and Delirium in Older Adults, After Cardiac Surgery, the Engages Canada Randomized Clinical Trial. Importance: Intraoperative electroencephalogram, EEG, waveform suppression, suggesting excessive general anesthesia, has been associated with postoperative delirium. Objective: to assess whether EEG-guided anesthesia decreases the incidence of delirium after cardiac surgery. Design, setting, and participants: randomized, parallel group clinical trial of 1,140 adults, 60 years or older, undergoing cardiac surgery at 4 Canadian hospitals. Recruitment was from December 2016 to February 2022, with follow-up until February 2023. Interventions: patients were randomized in a 1-to-1 ratio, stratified by hospital, to receive EEG-guided anesthesia, N equals 567, or usual care, N equals 573. Patients and those assessing outcomes were blinded to group assignment. Conclusions and relevance among older adults undergoing cardiac surgery: EEG-guided anesthetic administration to minimize EEG suppression, compared with usual care, did not decrease the incidence of postoperative delirium. This finding does not support EEG-guided anesthesia for this indication. Next, we will be discussing articles from Annals of Internal Medicine. Comparative effectiveness and safety of Apixaban, Rivaroxaban, and Warfarin in patients with cirrhosis and atrial fibrillation, a nationwide cohort study. Background: Apixaban, Rivaroxaban, and Warfarin have shown benefit for preventing major ischemic events, albeit with increased bleeding risk, among patients in the general population with atrial fibrillation, AF. However, data are scarce in patients with cirrhosis and AF. Objective: to compare the effectiveness and safety of Apixaban versus Rivaroxaban and versus Warfarin in patients with cirrhosis and AF. Conclusion: among patients with cirrhosis and nonvalvular AF, initiators of Rivaroxaban versus Apixaban had significantly higher rates of major hemorrhage and similar rates of ischemic events and death. Initiation of Warfarin versus Apixaban also contributed to significantly higher rates of major hemorrhagic events, including hemorrhagic stroke. Next, we will be discussing articles from British Medical Journal. Lee Silverman voice treatment versus NHS speech and language therapy versus control for dysarthria in people with Parkinson's disease, PD-COMM, pragmatic, UK-based, multicentre, 3-arm, parallel group, unblinded, randomized controlled trial. Objectives: to assess the clinical effectiveness of two speech and language therapy approaches versus no speech and language therapy for dysarthria in people with Parkinson's disease. Design: pragmatic, UK-based, multicentre, 3-arm, parallel group, unblinded, randomized controlled trial. Setting: the speech and language therapy interventions were delivered in outpatient or home settings between September 26, 2016 and March 16, 2020. Participants: 388 people with Parkinson's disease and dysarthria. Conclusions: LSVT. Loud was more effective at reducing the participant-reported impact of voice problems than was no speech and language therapy and NHS speech and language therapy. NHS speech and language therapy showed no evidence of benefit compared with no speech and language therapy. Next, we will be discussing articles from Lancet. Long-term colchicine for the prevention of vascular recurrent events in non-cardioembolic stroke, CONVINCE, a randomized controlled trial. Background: anti-inflammatory therapy with long-term colchicine prevented vascular recurrence in coronary disease. Unlike coronary disease, which is typically caused by atherosclerosis, ischemic stroke is caused by diverse mechanisms including atherosclerosis and small vessel disease, or is frequently due to an unknown cause. We aimed to investigate the hypothesis that long-term colchicine would reduce recurrent events after ischemic stroke. Interpretation. Although no statistically significant benefit was observed on the primary intention to treat analysis, the findings provide new evidence supporting the rationale for anti-inflammatory therapy in further randomized trials. Post-trial monitoring of a randomized controlled trial of intensive glycemic control in type 2 diabetes extended from 10 years to 24 years. UK BD's 91 background. The 20-year UK prospective diabetes study showed major clinical benefits for people with newly diagnosed type 2 diabetes randomly allocated to intensive glycemic control with sulfonylurea or insulin therapy or metformin therapy compared with conventional glycemic control. 10-year post-trial follow-up identified enduring and emerging glycemic and metformin legacy treatment effects. We aimed to determine whether these effects would wane by extending follow-up for another 14 years. Interpretation. Early intensive glycemic control with sulfonylurea or insulin, or with metformin, compared with conventional glycemic control, appears to confer a near-lifelong reduced risk of death and myocardial infarction. Achieving near normoglycemia immediately following diagnosis might be essential to minimize the lifetime risk of diabetes-related complications to the greatest extent possible. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Methylphenidate versus placebo for treating fatigue in patients with advanced cancer, randomized, double-blind, multicenter, placebo-controlled trial. Purpose: to compare effects and side effects of 6 weeks of individually dose-titrated methylphenidate or placebo on fatigue in palliative care patients with advanced cancer. Conclusion: after 6 plus or minus 2 weeks of treatment, methylphenidate was not superior to placebo for treating fatigue in advanced cancer. Methylphenidate was safe and well tolerated. Phase IB study of unesbulin, PTC 596, plus dacarbazine for the treatment of locally recurrent, unresectable or metastatic, relapsed or refractory leiomyosarcoma. Purpose: this multicenter, single-arm, open-label, Phase IB study was designed to determine the recommended Phase II dose, RP2D, and to evaluate the safety and preliminary efficacy of unesbulin plus dacarbazine, DTIC, in patients with advanced leiomyosarcoma, LMS. Patients and methods. Adult subjects with locally advanced, unresectable or metastatic, relapsed or refractory LMS were treated with escalating doses of unesbulin orally twice per week in combination with DTIC 1000 mg/m2 intravenously for once every 21 days. The time to event continual reassessment method was used to determine the RP2D on the basis of dose-limiting toxicities, DLTs, assessed during the first 2 21-day treatment cycles. All explored doses of unesbulin, 200 mg up to 400 mg, were in combination with DTIC. An expansion cohort was enrolled to evaluate the safety and efficacy of unesbulin at the RP2D. Conclusion: unesbulin 300 mg twice per week, plus DTIC 1000 mg/m2 once every 21 days, was identified as the RP2D, demonstrating a favorable benefit-risk profile in a heavily pretreated population of adults with advanced LMS. Here are the articles from Journal of COMM. Hepatology using liver stiffness to predict and monitor the risk of decompensation and mortality in patients with alcohol-related liver disease. Liver stiffness, LSM, can be used to prognosticate and monitor alcohol-related liver disease. Elevated baseline LSM, greater than or equal to 10 kPa, was associated with a 19-fold increased risk of decompensation. LSM changes after a median of 2 years were associated with the risk of decompensation and death. LSM increasers had lower decompensation-free survival and elevated risk of outcomes. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Clinical Gastroenterology. Validation of the laryngeal cognitive affective tool. Background and aims. Cognitive affective processes, including hypervigilance and symptom-specific anxiety, may contribute to chronic laryngeal symptoms and are potentially modifiable. However, a validated instrument to assess these constructs is lacking. The aims of this study were to develop and validate the laryngeal cognitive affective tool, LCAT, instrument. Methods. This two-phase single-center prospective study enrolled participants from November 2021 to June 2023. In the initial phase, 1-to-1 patient cognitive interviews and multidisciplinary team consensus were conducted to develop the LCAT. In the second phase, asymptomatic and symptomatic participants completed a series of questionnaires to examine psychometric properties of the LCAT. Conclusions. The 15-item LCAT evaluates laryngeal hypervigilance and symptom-specific anxiety among patients with laryngeal symptoms. It has excellent reliability and construct validity. The LCAT highlights burdensome cognitive affective processes that can accordingly help tailor treatments. Outcomes of high-grade immune checkpoint inhibitor hepatitis in hospitalized and non-hospitalized patients. Background and aims. Guidelines recommend hospitalization for severe immune checkpoint inhibitor, ICI, hepatitis. We compared patient outcomes in the inpatient versus outpatient settings. Methods. We conducted a multicenter, retrospective cohort study of 294 ICI-treated patients who developed grade 3 to 4 ICI hepatitis. The primary outcome was time to alanine aminotransferase, ALT, normalization, less than or equal to 40. Secondary outcomes included time to ALT less than or equal to 100 UL, and time to death. To account for confounding by indication, inverse probability of treatment weighting was applied to perform Cox regression. A sensitivity analysis was performed, excluding patients with grade 4 hepatitis. Conclusions. Hospitalization of patients with high-grade ICI hepatitis was not associated with faster hepatitis resolution and did not affect mortality. Routine hospitalization may not be necessary in all patients with high-grade ICI hepatitis, and common terminology criteria for adverse events criteria may overestimate severity of liver injury. Being breastfed in infancy, and risk of colorectal cancer and precursor lesions. Background and aims. Emerging evidence implicates the importance of perinatal and early life exposures in colorectal cancer, CRC, development. However, it remains unclear whether being breastfed in infancy is associated with CRC risk in adult life, particularly early adulthood. Methods. Cox regression and logistic regression for clustered data were used to estimate hazard ratios for CRC and odds ratios for CRC precursors, respectively. Conclusions. Being breastfed in infancy was associated with increased risk of CRC in adulthood, including among younger adults. However, further research is needed to understand the underlying biological mechanisms, as this association does not establish causation. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Development of patient safety measures to identify inappropriate diagnosis of common infections. Background. Inappropriate diagnosis of infections results in antibiotic overuse and may delay diagnosis of underlying conditions. Here we describe the development and characteristics of two safety measures of inappropriate diagnosis of urinary tract infection, UTI, and community-acquired pneumonia, CAP, the most common inpatient infections on general medicine services. Methods. Measures were developed from guidelines and literature and adapted, based on data from patients hospitalized with ICE, UTI and CAP, in 49 Michigan hospitals and feedback from end users, a technical expert panel, TEP, and a patient focus group. Each measure was assessed for reliability, validity, feasibility, and usability. Conclusions. We developed highly reliable, valid, and usable measures of inappropriate diagnosis of UTI and CAP for hospitalized patients. Hospitals seeking to improve diagnostic safety, antibiotic use, and patient care should consider using these measures to reduce inappropriate diagnosis of CAP and UTI. Central nervous system antimicrobial exposure, and proposed dosing for anthrax meningitis. Background: the high mortality of systemic anthrax is likely a consequence of the severe central nervous system inflammation that occurs in anthrax meningitis. Effective treatment of such infections requires, at a minimum, adequate cerebrospinal fluid, CSF, antimicrobial concentrations. Methods: we reviewed English, medical literature and regulatory documents to extract information on serum and CSF exposures for antimicrobials with in vitro activity against Bacillus anthracis, using CSF pharmacokinetic exposures and in vitro B anthracis susceptibility data. We used population pharmacokinetic modeling and Monte Carlo simulations to determine whether a specific antimicrobial dosage would likely achieve effective CSF antimicrobial activity in patients with normal to inflamed meninges, Y, and intact to markedly disrupted blood-brain barrier. Conclusions: prompt empiric antimicrobial therapy of patients with suspected or confirmed anthrax meningitis may reduce the high morbidity and mortality. Our data support using several beta-lactam, fluoroquinolone, and tetracycline class antimicrobials as first-line and alternative agents for treatment of patients with anthrax meningitis. All should achieve effective microbiologic exposures. Our data suggest antimicrobials that should not be relied on to treat suspected or documented anthrax meningitis. Furthermore, the protein synthesis inhibitors, clindamycin and linezolid, can decrease toxin production and may be useful components of combination therapy. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Journal of Clinical Rheumatology. Choroidal thickness is a biomarker associated with response to treatment in ankylosing spondylitis. Objective: choroidal thickness, CT, has been evaluated as a marker of systemic inflammation in ankylosing spondylitis, AS. This study evaluates the CT of AS patients before and after 6 months of biological treatment. Methods: this longitudinal multicentre study evaluated CT in 44 AS patients. The correlations between CT and C-reactive protein, CRP, with disease activity indices were calculated. The concordance between CT and CRP was determined. We assessed factors associated with response to treatment. Clinically important improvement was defined as a decrease in ankylosing spondylitis disease activity score of 1.1 points or greater. Conclusions: choroidal thickness decreased significantly after 6 months of biological treatment in all treatment groups. Choroidal thickness and CRP had a 95% concordance. A high CT was associated with a risk of biological treatment failure. Choroidal thickness can be considered a useful biomarker of inflammation and a factor associated with response to treatment in AS. Here are the articles from Arthritis and Rheumatology. Using 2 predictive models to capture 2 types of poor outcomes in knee arthroplasty, a multi-site longitudinal cohort study. Objective: poor outcome after knee arthroplasty, KA, a common major surgery worldwide, reportedly occurs in approximately 20% of patients. These patients demonstrate minimal improvement, at least moderate knee pain, and difficulty performing many routine daily activities. The purposes of our study were to comprehensively determine poor outcome risk after KA, and to identify predictors of poor outcome. Methods: data from 565 participants with KA in the Osteoarthritis Initiative and the multicentre osteoarthritis studies were used. Previously validated latent class analyses, LCAs, of good versus poor outcome trajectories of Western Ontario and McMaster University's Arthritis Index, WAMUC, pain, and disability were generated to describe minimal improvement and poor final outcome. The modified Escobar-Rand appropriateness system was used to generate classifications of appropriate, inconclusive, and rarely appropriate. Multivariable prediction models included LCA-based good versus poor outcome, modified Escobar classifications, and evidence-driven preoperative prognostic variables. Conclusion. Appropriateness criteria and LCA estimates provided combined poor outcome estimates that were approximately double the commonly reported poor outcome of 20%. Rates of poor outcome could be reduced if clinicians screened patients using appropriateness criteria and LCA predictors before surgery to optimize outcome. Next, we will be discussing articles in the field of cardiology. Here are the articles from journals of the American College of Cardiology. Effects of rapid uptitration of neurohormonal blockade on effective, sustainable decongestion and outcomes in strong HF. Background. Comprehensive uptitration of neurohormonal blockade targets fundamental mechanisms underlying development of congestion and may be an additional approach for decongestion after acute heart failure, AHF. Objectives. This hypothesis was tested in the strong HF, safety, tolerability, and efficacy of rapid optimization, helped by N-terminal pro-brain natriuretic peptide testing of heart failure therapies. Trial methods. In strong HF, patients with AHF were randomized to the high-intensity care, HIC, arm with fast uptitration of neurohormonal blockade, or to usual care, UC. Successful decongestion was defined as an absence of peripheral edema, pulmonary rales, and jugular venous pressure less than 6 cm. Conclusions. In strong HF, intensive uptitration of neurohormonal blockade was associated with more efficient and sustained decongestion at day 90 and a lower risk of the primary endpoint. OCT-guided versus angiography-guided coronary stent implantation in complex lesions. An Illumian 4 substudy. Background. Illumian 4 was the first large-scale, multicentre, randomized trial comparing optical coherence tomography, OCT-guided versus angiography-guided stent implantation in patients with high-risk clinical characteristics and/or complex angiographic lesions. Objectives. The authors aimed to specifically examine outcomes in the complex angiographic lesions subgroup. Methods. From the original trial population, N equals 2,487. High-risk patients without complex angiographic lesions were excluded. N equals 514. Complex angiographic lesion characteristics included 1. Long or multiple lesions with intended total stent length greater than or equal to 28 am. 2. Bifurcation lesion with intended 2 stent strategy. 3. Severely calcified lesion. 4. Chronic total occlusion, or 5. In-stent restenosis. The study endpoints were 1. Final minimal stent area, MSA. 2. 2-year composite of serious major adverse cardiovascular events, MESAs, cardiac death, target vessel myocardial infarction, MI, or stent thrombosis, and 3. 2-year effectiveness, defined as target vessel failure, TVF, a composite of cardiac death, target vessel MI, or ischemia-driven target vessel revascularization. Conclusions. In complex angiographic lesions, OCT-guided PCI led to a larger MSA and reduced the serious MACE, the composite of cardiac death, target vessel MI, or stent thrombosis, compared with angiography-guided PCI at 2 years, but did not significantly improve TVF. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Effects of exogenous GIP and GLP-2 on bone turnover in individuals with type 2 diabetes. Context. Individuals with type 2 diabetes, T2D, have an increased risk of bone fractures despite normal or increased bone mineral density. The underlying causes are not well understood, but may include disturbances in the gut-bone axis, in which both glucose-dependent insulinotropic polypeptide, GIP, and glucagon-like peptide 2, GLP-2, are regulators of bone turnover. Thus, in healthy fasting participants, both exogenous GIP and GLP-2 acutely reduce bone resorption. Objective. The objective of this study was to investigate the acute effects of subcutaneously administered GIP and GLP-2 on bone turnover in individuals with T2D. Methods. We included 10 men with T2D. Participants met fasting in the morning on 3 separate test days and were injected subcutaneously with GIP, GLP-2, or placebo in a randomized crossover design. Blood samples were drawn at baseline and regularly after injections. Bone turnover was estimated by circulating levels of collagen type 1, C-terminal telepeptide, CTX, procollagen type 1, N-terminal prepeptide, P1NP, sclerostin, and PTH. Conclusion. Subcutaneous GIP and GLP-2 affect CTX and P1NP in individuals with T2D to the same extent as previously demonstrated in healthy individuals. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Prevalence of suicidality in adolescents with newly diagnosed focal epilepsy at diagnosis and over the following 36 months. Background and objectives. Individuals with epilepsy have increased risk of suicidal ideation, SI, and behaviors when compared with the general population. This relationship has remained largely unexplored in adolescents. We investigated the prevalence of suicidality in adolescents with newly diagnosed focal epilepsy within 4 months of treatment initiation and over the following 36 months. Methods. This was a post-hoc analysis of the enrollment and follow-up data from the Human Epilepsy Project, an international, multi-institutional study that enrolled participants between 2012 and 2017. Participants enrolled were 11 to 17 years of age within 4 months of treatment initiation for focal epilepsy. We used data from the Columbia Suicide Severity Rating Scale, CSSRS, administered at enrollment and over the 36-month follow-up period, along with data from medical records. Discussion. The prevalence of suicidality in adolescents with newly diagnosed focal epilepsy reported in our study is consistent with previous findings of significant suicidality observed in epilepsy. We identify adolescents as an at-risk population at the time of epilepsy diagnosis and in the follow-up. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. International variation in severe exacerbation rates in patients with severe asthma. Background. Exacerbation frequency strongly influences treatment choices in patients with severe asthma. Research question. What is the extent of the variability of exacerbation rate across countries and its implications in disease management? Study design and methods. We retrieved data from the International Severe Asthma Registry, an international observational cohort of patients with a clinical diagnosis of severe asthma. We identified patients aged greater than or equal to 18 years who did not initiate any biologics prior to baseline visit. A severe exacerbation was defined as the use of oral corticosteroids for greater than or equal to 3 days or asthma-related hospitalization/ED visit. A series of negative binomial models were applied to estimate country-specific severe exacerbation rates during 365 days of follow-up, starting from a naive model with country as the only variable to an adjusted model with country as a random effect term and patient and disease characteristics as independent variables. Interpretation. Individuals with similar patient characteristics, but coming from different jurisdictions, have varied severe exacerbation risks, even after controlling for patient and disease characteristics. This suggests unknown patient factors or system-level variations at play. Disease management guidelines should recognize such between-country variability. Risk prediction models that are calibrated for each jurisdiction will be needed to optimize treatment strategies. Clinician and patient identified solutions to reduce the fragmentation of post-ICU care in Australia. Background. Critical care survivors experience multiple care transitions, with no formal follow-up care pathway. Research question. What are the potential solutions to improve the communication between treating teams and integration of care following an ICU admission, from the perspective of patients, their caregivers, intensivists, and general practitioners, GPs, from diverse socioeconomic areas? Study design and methods. This study included a qualitative design using semi-structured interviews with intensivists, GPs, and patients and caregivers. Framework analysis was used to analyze data and to identify solutions to improve the integration of care following hospital discharge. Patients were previously mechanically ventilated for greater than 24 hours in the ICU and had access to a video-enabled device. Clinicians were recruited from hospital networks and a statewide GP network. Interpretation. Practical solutions to enhance the quality of survivorship for critical care, survivors and their caregivers were identified. These themes are mapped to a novel conceptual model that includes key feedback loops for health system improvements and foci for future interventional trials to improve ICU survivorship outcomes. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. The role of neighborhood air pollution in disparate racial and ethnic asthma acute care use. Rationale. The share of Black or Latinx residents in a census tract remains associated with asthma-related emergency department (ED) visit rates after controlling for socioeconomic factors. The extent to which evident disparities relate to the within-city heterogeneity of long-term air pollution exposure remains unclear. Objectives. To investigate the role of intra-urban spatial variability of air pollution in asthma acute care use disparity. Methods. An administrative database was used to define census tract population-based incidence rates of asthma-related ED visits. We estimate the associations between census tract incidence rates and 1. Average fine and coarse particulate matter, nitrogen dioxide, NO2, and sulfur dioxide, SO2, and 2. Racial and ethnic composition, using generalized linear models controlling for socioeconomic and housing covariates. We also examine for the attenuation of incidence, risk ratios, IRRs, associated with race/ethnicity when controlling for air pollution exposure. Conclusions. Neighborhood-level rates of asthma acute care use are associated with local air pollution. Controlling for air pollution attenuates associations with census tract racial/ethnic composition, suggesting that intracity variability in air pollution could contribute to neighborhood asthma morbidity disparities. Predicting obstructive sleep apnea based on computed tomography scans using deep learning models. Rationale. The incidence of clinically undiagnosed obstructive sleep apnea, OSA, is high among the general population because of limited access to polysomnography. Computed tomography, CT, of craniofacial regions obtained for other purposes can be beneficial in predicting OSA and its severity. Objectives. To predict OSA and its severity based on paranasal CT, using a three-dimensional deep learning algorithm. Methods. 1 internal dataset, N equals 798, and 2 external datasets, N equals 135 and N equals 85, were used in this study. In the internal dataset, 92 normal participants and 159 with mild, 201 with moderate, and 346 with severe OSA were enrolled to derive the deep learning model. A multimodal deep learning model was elicited from the connection between a three-dimensional convolutional neural network-based part, treating unstructured data, CT images, and a multilayer perceptron-based part, treating structured data, age, sex, and body mass index, to predict OSA and its severity. Conclusions. A novel deep learning model, including a multimodal deep learning model, and an airway highlighting preprocessing algorithm from CT images obtained for other purposes, can provide significantly precise outcomes for OSA diagnosis. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Acute kidney injury, systemic inflammation, and long-term cognitive function, assess AKI. Background. Cognitive dysfunction is a well-known complication of CKD, but it is less known whether cognitive decline occurs in survivors after AKI. We hypothesized that an episode of AKI is associated with poorer cognitive function, mediated, at least in part, by persistent systemic inflammation. Methods. Assessment, serial evaluation, and subsequent sequelae of AKI, enrolled patients surviving 3 months after hospitalization with and without AKI, matched on the basis of demographics, comorbidities, and baseline kidney function. A subset underwent cognitive testing using the Modified Mini Mental Status Examination, 3MACE, at 3, 12, and 36 months. We examined the association of AKI with 3MS scores using mixed linear models and assessed the proportion of risk mediated by systemic inflammatory biomarkers. Conclusions: CACI was associated with lower 3MS scores, and soluble TNF receptor 1 concentrations seemed to mediate a significant proportion of the risk of long-term cognitive impairment. Further work is needed to determine whether AKI is causal or a marker for cognitive impairment. Here are the articles from Kidney International Reports. Effects of once-weekly semaglutide on kidney disease outcomes by KDIGO risk category in the SUSTAIN-6 trial. Introduction. Glucagon-like peptide-1 receptor agonists, GLP-1 are recommended by kidney disease, improving global outcomes, KDIGO, as risk-based treatment for hyperglycemia, weight management, and cardiovascular, CV, risk reduction in people with type 2 diabetes, T2D, and chronic kidney disease, CKD. The aim of this post-hoc analysis was to assess treatment effects of once-weekly semaglutide on kidney disease outcomes by KDIGO risk category and on changes in KDIGO risk category compared with placebo. Methods. Participants with T2D and established CV disease, or at high CV risk, treated with once-weekly semaglutide or placebo in SUSTAIN-6, NCT 017-20446, were stratified by baseline KDIGO risk category, low, N equals 1,596, moderate, N equals 831, high, N equals 445, very high, N equals 366. Treatment effect was analyzed for a kidney disease composite endpoint, macroalbuminuria, serum creatinine doubling, and estimated glomerular filtration rate, YGFR, less than 45 milliliters per minute per 1.73 square meters, kidney replacement therapy, or death due to kidney disease, from baseline to 2 years. Conclusion. Once-weekly semaglutide versus placebo reduced risks of kidney disease endpoints and improved risk categories, irrespective of baseline KDIGO risk. Efficacy and safety of lumasiran in patients with primary hyperoxaluria type 1 results from a phase 3 clinical trial. Introduction. Patients with primary hyperoxaluria type 1, PH1, a genetic disorder associated with hepatic oxalate overproduction, frequently experience recurrent kidney stones and worsening kidney function. Lumasiran is indicated for the treatment of PH1 to lower urinary and plasma oxalate, POX. Methods. Illuminate A, NCT 03681-184, is a phase 3 trial in patients aged greater than or equal to 6 years with PH1 and estimated glomerular filtration rate, YGFR, greater than or equal to 30 mmol per minute per 1.73 square meters. A 6-month double-blind placebo-controlled period is followed by an extension period, less than or equal to 54 months. All patients receive lumasiran. We report interim data through month 36. Conclusion. In patients with PH1, longer-term lumasiran treatment led to sustained reduction in UOX excretion, with an acceptable safety profile and encouraging clinical outcomes. Prospective study of change in skin autofluorescence over time and mortality in people receiving hemodialysis. Introduction. Elevated skin autofluorescence, SAF, a measure of tissue accumulation of advanced glycation end products, GAGEs, is a strong predictor of all-cause and cardiovascular mortality in the hemodialysis population. However, prospective studies investigating the association between changes in SAF over time and mortality are scarce. We therefore aimed to investigate the prognostic value of SAF trend for predicting mortality in a hemodialysis population. Methods. We enrolled 120 patients on hemodialysis in a 5-year observational prospective study. SAF was measured at baseline, 3, 6, 9, 12, and 24 months. Rate of change in SAF, i.e., SAF trend, was calculated using linear regression. Time to event was the number of days from baseline to death, kidney transplantation, or March 31, 2022. Conclusion: an increasing SOF trend and higher baseline SOF were independent predictors of all-cause mortality in this hemodialysis population, suggesting that monitoring of SOF may have clinical utility. Strategies to improve outcomes by reducing or preventing the increase in SOF should now be investigated in prospective studies. Italcalcitide use during maintenance hemodialysis and incidence of parathyroidectomy after kidney transplantation. Introduction: italcalcitide is an IV calcimimetic agent, effectively reducing parathyroid hormone levels in patients on maintenance hemodialysis, HD. The clinical impact of discontinuing italcalcitide at the time of kidney transplantation is unknown. Methods: we retrospectively reviewed all patients on HD meeting predefined criteria who received a kidney transplant at our institution between January 1, 2015, and December 12, 2022. The incidence of parathyroidectomy and the evolution of calcium, phosphate, and intact parathyroid hormone, IPTH, levels after transplantation was analyzed according to the type of calcimimetic treatment before transplantation, cinacalcit versus italcalcitide versus none. Conclusion: italcalcitide use during maintenance HD is associated with an increased incidence of early parathyroidectomy after transplantation compared to cinacalcit or no calcimimetic.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.